Good evening, everyone, and welcome. We have a special interview on cranial sacral therapy, and we have Dr. Justine here and Dr. Linda Finn. Please help me welcome them.
All right. Hello, everybody. Today I have an exciting topic, and I'm so happy that Linda Finn is with us. She's our naturopath as well as our physiotherapist at the Justine Blaney Wellness Center. And personally, she's my naturopath and has worked with me for naturopathy and physiotherapy. And she's worked with my mom. So I wanted to talk a little bit about what is cranial sacral therapy and how does it help people and how has it been used on me? So certainly over the years, I have had cranial sacral therapy to help my upper part of your neck and to help my skull and brain work better, which can help people with balance, with coordination, with headaches, with damage to the spine. But I also had it done with my daughter and my son after C-section births, and they didn't get to go through the birth canal. So we had an opportunity to work on their craniosacral balance. So Linda, welcome. Excited that you can be here, and just thank you for the work that you've done on me and the work that you've done on my family. One of the first questions I wanted to talk about was, well, just like, how did you learn about craniosacral therapy yourself? What got you interested in it?
Yeah, well, it's been my pleasure, Justine, to treat you and your family. Thank you so very much for the opportunity. And yeah, it really has been a very integral part of my practice for a long time because I was only 2 years into practice, and the first craniosacral training course in Canada that had ever been held in Canada was held, and I was a member of that class. And it really changed my therapeutic toolkit at that point. And that was way back in the 80s. And when I experienced basically what it could do for my body, because we were working on each other with permission in the class, I just knew I needed to take more courses. So I took several courses and then just kept working at it.
So when you say courses, what kind of training does it involve? I know already you had the training as a physiotherapist and a natural. You had this extensive, framework going into this and already huge knowledge of the body and the nervous system. But after all of those years of education, what kind of training did it involve after that?
So it is something that should be practiced by a healthcare professional, it requires extensive hands-on training so that your hands are sensitized to a very, very fine extent to be able to feel very fine textures and very fine tensions in the body. And it is offered through the Upledger Institute, which is down in West Palm Beach, but they also hold courses across Canada and the United States. And they train healthcare practitioners to be able to do this type of work.
Great. And one of the things that I certainly noticed was just how gentle it was, and just such essential gentle technique, which is for many people exactly what they need. And certainly when I had my children, they were just infants. I wanted to make sure that this gentle technique was done for them because they didn't get the opportunity for that natural birth through the birthing canal. So can you describe what cranial sacral therapy is and what it feels like and what you're looking for?
Yeah, so this is a very gentle, hands-on, non-invasive whole body treatment. And the purpose of that is to evaluate and also to enhance the function of the craniosacral system and the fascia associated with it. So I'll just talk about what the craniosacral system is so that you can understand that. So it's comprised of about 4 components. The first is your brain and your spinal cord. The second is the membranes, basically, that are around the brain and spinal cord. And then there's your tailbone. And people would wonder, why on earth your tailbone? But, if you know the anatomy, you know that the spinal cord actually terminates on the tailbone. So there is an interconnection there. And the final component is fascia. And fascia is like a network mesh that is continuous throughout the body. And I'll talk a little bit more in a minute about that, but that's also a component of the cranial system. So we know that there's motion in this system. So that's a fascinating thing, because actually your skull is very gently, let me just show my model here. If you imagine this is like your skull, and what's happening is your skull is very gently expanding and contracting, expanding and contracting, expanding and contracting. And at the same time, you've basically got the spinal cord going up and down in a rhythm, 12 to 15 times a minute. And so that's pretty fascinating. And then the other component, the fascial component that I wanted to talk about, because it's really very important in cranial work. It's like this network mesh of connective tissue. It's under the skin, and it's very extensive. So basically speaking, if you took out all the tissues and other organs and left just the fascia, you'd have a replica of the whole human body. So that means it's not only surrounding all the other organs and tissues, it's also supporting them. And because it's a continuous network, this means that if you disrupt the fascia, it can have quite an effect, or altered effects on some of those other tissues and structures. And in fact, the fascia really makes the body mechanically continuous, if you want to think about it that way. But the fascia also communicates, it has receptors in it that communicate with the central nervous system and also connect with the craniosacral system. So say, for example, if we had a soft tissue injury and the soft tissue is healing, but somehow or other there's still a restriction in the fascia can basically impede the other structures' functions, so they don't perform as well as they should. And it can also affect the craniosacral system. So you can kind of see how things are interconnected here.
And Linda, so what kind of conditions would you work with this craniosacral? What would make you turn to this as part of your toolkit?
So I always do an orthopedic assessment with people prior to deciding which tools in my kit to take out and to use for them. But it's very interesting because there was actually a systematic review and meta-analysis. And for people that don't know, what that is an evidence-based approach to try and evaluate how effective treatments are. And this was actually done in 2020, and it was done with respect to the efficacy of craniosacral therapy. So very appropriate for this talk. And it showed a significant and robust effect of craniosacral therapy on chronic pain and altered function lasting for at least 6 months after the treatment phase. So that is really impressive from an evidence-based standpoint, that it really can be very effective. So, they mentioned in the study they were looking particularly at chronic pain and altered function related to chronic pain. So, of course, I'm going to be using it for chronic neck and low back pain, sometimes also for acute neck and low back pain, motor coordination impairments, orthopedic problems, like say, for example, elbows or knees or whatever. I may use components of that, fascial components, central nervous system problems, concussions, scoliosis, stress and tension related problems, fibromyalgia. And one of my favorites, because I used to work with a dentist and an orthodontist for several years, is to work on the Tmj joint. And so that's really exciting too.
And people suffer with TMJ, and even now with more stress going on, people are clenching more to manage that stress, and then that's creating that fascial tension and the tension then to the neck and the shoulders, which can lead to headaches and migraines. And I know it can as I've made referrals, people with different forms of anxiety and depression and migraines have found huge success with this. And it's just so gentle, just like you would touch your eyelid, which is great when people are suffering with some of these chronic conditions. What kind of ages are you working with? Like, what kind of age could start for you?
Well, craniosacral therapy can be used essentially for all ages, from infants all the way up to elderly people. Of course, in my practice, I'm seeing more sort of older children, adolescents, adults in my practice, but it can be used for birth trauma in infants. And it can be as you said, it can be tolerated by all ages, because of its gentleness. That's why I love it so much for people in acute pain, because you can't really make them worse because it's so gentle, and they
Right.
get relief. And you know, it's wonderful
That's a
that way.
huge help. And the one of the things that I wanted to go over was how long does a treatment take?
So it normally takes about half an hour, but of course, it depends. There might be some extenuating circumstances where we might need an hour, but that's rare. So for the most part, it's like a half-hour treatment. Should be good. And then, you know, sometimes you have to do subsequent treatments. I
Mhm.
have had people quite improved even with one treatment at times, depending on, you know, how extensive the problem is.
And for those that don't know, are you using any equipment, using your hands? Like, what should they expect if they're doing the treatment? Are they laying down? Are they sitting down? What is the position of the patient? What should they expect if they're coming in and receiving cranial sacral therapy?
So the great thing is that you're very comfortable during treatment. What you don't have to disrobe like for a massage. I mean, massage is wonderful, but this is a different modality. So people are fully clothed and comfortably lying on a massage table or some other bed. If they want, say, for example, a blanket, like I try and make the room temperature very comfortable for them. But if they want a blanket, that's fine, you know, because if I'm working on the head, you know, basically it's okay to have a blanket. But if I'm working on the body, we might take the blanket off, whatever. Um, but it's so gentle. What they would basically feel is my hands on the head initially, and very, very gently. It's like the weight of a nickel is the type of tactile pressure that you're putting to do this kind of work. So it's very, very gentle. So people find it quite calming. It can decrease nervous system excitability. It can help to balance the autonomic nervous system. So people feel extremely relaxed during and after treatment. And yeah, it's just a very comfortable procedure.
I can tell everybody when I've had it done, I almost feel like I'm gonna fall asleep. Like it's so gentle that you almost go into like a meditative state. Your breathing slows down, your heart rate slows down. And for somebody who's go, 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 this is actually a good time to just kind of chill and bring the system, that fight or flight system down, which helps all other parts of the body, which is great. I mean, and as Linda said, this has been around for a while. This isn't a new technique. And the research, as you saw, was just even just recently, it's been done all the time, but even in 2020, it is something to help relax that body, help with different injuries, help with different chronic pain, help to manage tension that many of us are just feeling in these tough times. So, Linda, thank you so much for the interview. And those who are interested in learning more about cranial sacral therapy, you can do a sort of meet and greet, a chat. That can be done virtually with Linda or by phone or in person, just to make sure it's the right fit for you before making a full assessment and appointment. Of course, just making sure that a treatment cannot be performed without a full examination done first. Linda is truly a professional. She's going to be very thorough in her examination and determining the right care for you. But if you're interested in learning more, please contact Dr. Linda Finn at the Justine Blaney Wellness Center, and she'd be happy to address some of your questions. You know, a 5-minute chat. Meet and greet before you make that appointment. You can contact the office and you'll see the number there below. So Linda, I know you're in the middle of your busy day and you're just helping so many people at the Justine Blaine Wellness Center. Thank you for your time and have a wonderful day.
Yes, and you too, Justine. Thank you for the opportunity to speak on this. It's a wonderful topic and really helps a lot of people. Thank you so
It
much.
does. It does. Thank you.